Good morning. Governor DeSantis signed Bill SB 1718 into law on May 10th, going into effect July 1st, 2023. I'm going to break down the various parts of the bill for you. The first part covers Florida companies. Private employers who have more than 25 employees are required to use the E-Verify system when hiring new employees. The federal system verifies people's work eligibility. The state will issue fines to companies who hire unauthorized individuals, meaning undocumented migrants. Documented migrants can obtain a work permit as long as they have a pending status application. Side note, since 1996, E-Verify is a free digital immigration verification service. It has existed to help employers ensure that their hired workforce is authorized to work in the United States. The E-Verify system is currently used by around 15 states. Example, Missouri has been using this system since 2009. Florida started using this system in 2020. The next part concerns transportation. If a person knowingly brings an undocumented migrant into the state, the person who can be charged with a third-degree felony. This is intended to penalize people who are committing human smuggling. The law makes no distinguishment between family members and relatives. So if a family member smuggles in an EWI relative, the family member can be charged. EWI is a common abbreviation used, and it means entry without inspection. Next part of the bill targets undocumented migrants who have a non-Florida driver's license and who cannot prove lawful presence. Florida will not recognize that driver's license, so if they get pulled over, they will get a ticket for not having a valid driver's license. I mentioned in a previous update that it is possible for undocumented workers to get driver's license. I believe there's around 12 states in the U.S. that allows it, with California and Illinois being two of those states. The next part of the bill targets hospitals. Every hospital that accepts Medicaid must include on its registration form 3 slots. Those slots are either U.S. citizen, or lawfully present in the U.S., or not lawfully present in the United States. The bill states that this shall not affect the patient's care and that the data will not generate a report to immigration authorities. The bill explains that they want a breakdown of services and costs and emergency room visits for each category of people in the hospitals. The hospitals are required to submit this info in a report to the Agency for Healthcare Administration every quarter. This makes sense. They need to know how much money they're spending for healthcare for everyone, and they do promise that this will not be used to deport illegal immigrants. The last part of the bill deals with counterterrorism and the state of Florida's cooperation with federal agencies with respect to immigration detainers and immigration enforcement and tackling counterterrorism activities. There's nothing really to break down because it's just talking about different committees, and honestly that was the most hard to understand. It's all legalese and nothing really is happening with that yet. So it's the first 3 parts that are more important than the fact that they're creating another committee, because that's what the government does, creates tons of committees and tons of agencies. Thanks for listening.